Well, it's a bureaucratic bungle that's become a public health nightmare. How were nearly 3,000 passengers allowed to disembark the Ruby Princess cruise ship in Sydney in the middle of a coronavirus pandemic when there was evidence of respiratory illness on board? Well, the New South Wales Health Minister has today defended the decision despite leaked emails showing that his department knew some passengers were acutely ill.
Cruise ships caught in coronavirus limbo, refuelled and stocked up. Foreign crew members were shuffled between ships in preparation for setting sail home. The latest development in frightening times.
We're all scared. We're all scared. I'm scared. We're all scared. Yeah, it's pretty terrible.
The strain is starting to show on the New South Wales Health Minister, forced to explain why nearly 3,000 passengers were allowed to disembark the Ruby Princess last month. Leaked emails show just before it docked in Circular Quay, the ship declared it had a mystery respiratory illness on board.
The emails confirm that the government and New South Wales Health knew that there were unwell passengers and passengers that had the symptoms of COVID-19. This is the greatest public health disaster in the history of this state.
The ship docked in Sydney just over 2 weeks ago, with nearly 2,700 people allowed to disembark. That was despite around a dozen of them getting tests for COVID-19. Before those results came back, passengers were getting in taxis, buses and boarding planes, heading to cities and towns across the country, including Toowoomba, Wollongong, Port Augusta, Darwin and Melbourne. We now know that 342 passengers in New South Wales alone have returned a positive test. 85 cases in South Australia have been linked to the ship, 75 in Queensland and 44 in WA, among others. So far, 11 people who weren't on board have caught the virus from one of these passengers. All up, the total number of known cases linked to the ship is nearly 600. That's around 1 in 10 of all cases nationwide. 7 of these people have died.
I want to apologise to individuals. None of the team involved in this would have had this intent and acted differently if they hadn't seen it as a higher risk.
We are today calling for the Health Minister to stand aside. He must take responsibility. This is his agency.
My role as the Minister is to make sure that I'm oversighting what the ministerial staff are doing, the expertise that's there, and I'm satisfied that the expertise is there.
Dozens of passengers have launched legal action against Carnival Cruises.
There appears to be a strong case against the cruise owners and operators, and it appears that this was a company that was putting profit before the health and safety of its passengers.
And a new storm is brewing.
We're going to see more crew members get sick as they go to sea. This is just wrong, and it's putting seafarers in harm's way.
A state desperate to clear the decks of a cruise ship crisis. Emily Lawrence, ABC News, Sydney.